This video provides information regarding features of the Protective Safety IV catheter, its use in the clinical setting, and various insertion techniques. Design features of the Protective Safety IV catheter. The Protective Safety IV catheter has two main components, the catheter and introducer needle. The catheter assembly includes a needle and housing to hold the device, a flash chamber which is incorporated into the housing area, and a porous plug that allows air to vent without fluid loss. One of the key features of the Protective Safety IV catheter is its unique needle guard. The needle guard is a clear hard plastic tube built into the housing area. The needle guard incorporates easy-to-hold grip pads. As the catheter is advanced into the patient's vein, the needle guard slides forward to fully encase and protect the exposed needle. The primary and secondary push-off tabs allow for easier threading of the catheter. The Protective Safety IV catheter flash chamber allows clear and easy visualization of flashback. Its unique porous plug allows air to vent without blood or fluid loss. When the needle is fully encased, an audible click is heard which signals that the needle is locked in the needle housing and it is safe to disconnect the catheter from the covered needle. One-handed insertion technique. Prepare the venipuncture site per institutional policy. With dominant hand, hold the Protective Safety IV catheter by the grip pads with the needle bevel up. The push-off tab on the upper surface is a bevel indicator. With gloved hand, anchor the vein with gentle skin traction below the insertion site, avoiding contamination. Insert the needle tip into the skin using an appropriate angle. When inserting the Protective Safety IV catheter, lower the angle of insertion to prevent puncturing of the posterior vein wall. As the needle enters the vein, a flashback of blood will confirm vein entry. If needed, slightly advance the catheter and needle together 3 to 5 millimeters to facilitate full catheter entry into the vein lumen. Ensure that the needle bevel and the tip of the catheter are fully seated in the internal lumen of the vein before threading off. A flashback of blood will confirm catheter entry into the vein lumen. To thread the catheter into the vein, place a finger behind the push-off tab and thread the catheter into the vein by advancing the push-off tab forward. The secondary push-off tabs may be used to assist in threading if needed. While threading the catheter into the vein, the needle guard begins to encase the needle. Using an index finger to stabilize the device at the push-off tab, withdraw the needle by pulling back on the grip pads until it is locked in the needle guard. An audible click and visual confirmation of the encased needle both indicate that the device is locked. Never reinsert the needle into the catheter, as the needle could cut the catheter. Remove the tourniquet. Apply digital pressure to the vein distal to the tip of the catheter. With dominant hand, hold the needle guard at the back end like a screwdriver. Stabilize the hub with the other hand and remove the needle guard by turning it slightly to the right or left. Disconnect and remove the needle guard from the catheter hub. Always dispose of the Protective Safety IV catheter in an approved Sharps container.